Coding and Documenting Psychiatric Services, presented by Veronica Hodges, Medical Billing and Coding Instructor and Coding Auditor. Let's talk for a moment about psychiatric diagnostic procedures. Diagnostic services involve patient assessment, including but not limited to history, mental status, review and/or order studies, recommendations, psychiatric specialty exam, prescription medication, and/or ordering lab tests. CPT codes and code descriptions are as follows: 90791 and 90792. Both codes include the assessment, the history, mental status, review and order diagnostic studies, and recommendations. Keep in mind that 90792 includes the psychiatric specialty exam, which is the medical exam, the physical exam that is usually provided by a psychiatrist, an NP, or a PA. Let's discuss psychotherapy for just a moment. CPT defines psychotherapy as the treatment of mental illness and behavior disturbances in which the physician and/or qualified health professional, through definitive therapeutic communication, attempts to alleviate the emotional disturbance, reverse or change maladaptive patterns of behavior, and encourage personality growth and development. Psychotherapy services are face-to-face encounters with the patient that may or may not include family members. Keep in mind that psychotherapy is a time-based service, so time must be documented appropriately. When coding and/or billing psychotherapy, it's very important to refer to the documentation for time, as time is required. Please refer to the list of codes listed: 90832, 90834, and 90837. The appropriate time is listed in the chart. Keep in mind that you cannot bill psychotherapy for encounters that are less than 16 minutes. Psychotherapy codes are categorized by those performed with or without an E&M service. Psychiatrists, nurse practitioners, and physician assistants can report psychotherapy codes in addition to E&M services. The same diagnosis can be used for both services on the same day. Time spent for psychotherapy cannot be used as the basis of the E&M service provided. Here again, psychotherapy and E&M codes can be reported on the same day. Keep in mind that psychotherapy cannot be billed for encounters that are less than 16 minutes. The list of codes for psychotherapy reported with E&M are as follows: 90833, 90836, and 90838. Keep in mind that it's very important that time is documented. Interactive complexity. Interactive complexity can be reported in addition to psychiatric, diagnostic, or psychotherapy codes. Circumstances in which interactive complexity can be reported are as follows: maladaptive communication among patients and/or family, difficulty or interference from a caregiver's emotion or behavior, a language barrier between the provider and the patient, a sentinel event that causes difficulty and an inability to communicate. The CPT code for interactive complexity is 90785. If you have any questions, feel free to contact me. I can be reached via email at vhodges@mcstlearning.com. I can be reached via phone or text message at 980-819-0865.